welcome to another insightful episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we are diving into a topic that can mean the difference between life and death, the golden hour in trauma. The first 60 minutes following a traumatic injury are absolutely critical, and the decisions made during this period significantly impact patients' survival and recovery. And to help us understand the intricacies of trauma care during this golden hour, we have with us an expert in the field, Dr. Anshul Jain. Dr. Anshul is an assistant professor and consultant in the Department of Emergency Medicine. He completed his MBBS and MD in Emergency Medicine from Government Medical College in Surat, one of the few NMC recognized institutes for emergency medicine in India. Dr. Anshul specializes in critical care, trauma management, airway emergency, and advanced resuscitation protocols. His deep expertise and frontline experience make him the perfect guest to discuss how timely interventions in trauma can be the deciding factor between life and death. So, Dr. Anshul, welcome to the show, and it is such a pleasure to have you here.
Thank you so much. Thank you so much, Hetvi. And it's actually my pleasure to be here on this platform. And thank you for inviting me. And yes, this is actually a very important topic, which actually each and everyone should know. Even a layman should know about this so that they can help each and everyone out there who suffer this traumatic brain injury. So, yes, this is a very important topic which we are about to start.
So, doctor, let's just start with the basics only. The term golden hour, it is often emphasized in trauma care. So, could you elaborate on what it means and why it is so crucial in determining patient outcomes?
Okay, so yes, good morning all. We are starting with the golden hour trauma as Hetvi has asked me, like what is golden hour and how, why do we emphasize more on this golden hour? So actually, golden hour in the context of trauma, it refers to the critical period immediately following a traumatic injury or an event when timely medical interventions can significantly improve the outcomes for the patient. Okay, so that is called as the golden hour of trauma. And this concept is particularly relevant in emergency medicine and trauma care, highlighting the importance of rapid assessment, stabilization, and treatment of injuries. Key points in the golden hour of trauma, why we are emphasizing more and more on this golden hour. Um, we can have the other hours as well, but this golden hour is very important in the trauma setup. Why? Because, first of all, time sensitivity is very important. The first hour of the trauma, as soon as the injury occurs in a patient, the first hour is very, very important, because if timely interventions are done in that patient, that can significantly improve the outcomes for the patient. If there is any delay in the treatment, suppose there is a patient who met with an accident around 3 or 4 hours back, and there was no one to help him around. He was brought to emergency or hospital after, suppose, 5 or 6 hours. So we actually have lost the important time framework which was available with us in the initial for the initial period of that, for the initial treatment of that patient. Okay, delay in the treatment can significantly lead to complications, increased morbidity, even mortality as well. So yes, we definitely need to have a very good pre-hospital care for obtaining this golden hour of trauma, for obtaining a very good golden hour of trauma in these cases. So yes, this is very important, and that's why we are emphasizing more and more on this particular first hour of the trauma. Okay, and yes, as I said that for this goal, for achieving timely interventions in many traumatic patients, we need a multidisciplinary approach. We need a very good pre-hospital care. We should be available with us. We should have a very trained, skilled emergency medical technician as well as their team who knows what to do, who should they should be ATLS trained, and they should be
Correct.
immediate, pre-hospital care should be immediately available as soon as possible to the patient, and they should be skilled enough to do the necessary interventions at the site and to bring the patient immediately to the emergency. So that's why this golden hour is very important. And yes, I've emphasized more on pre-hospital care. So pre-hospital care is very, very important in the developed countries like UK, US. They have a very good pre-hospital care. They have trained EMS. They have trained staffs who are skilled to do all the necessary interventions at the site only. So that's what is the need of an hour.
Actually, you have correctly emphasized, and I now understand why is it emphasized so much towards golden hour, and I think it really puts into the perspective that how timely intervention can save lives. Also, it's really important. So now, doctor, when dealing with multi-trauma patients, time is of essence. So how do you prioritize critical interventions like airway management, hemorrhage control, and fluid resuscitation in such cases?
Okay, so as soon as the patient arrives in emergency setup, as an emergency doctor, what our role is to first of all, as soon as the patient is received in ER, we have to first apply oxygen to the patient. We have to see whether the patient's uh, airway is protected or not. We are being told, we have been we have done all this ATLS training, advanced trauma life support training, in which we are taught that airway with cervical spine protection is the most important thing. So whenever we shift the patient from a spine board to the emergency bed, then cervical
Mhm.
spine care of along with the airway. Okay, so as soon as the patient comes in ER, we have to assess his airway first, then comes the breathing and the ventilation part, and then comes the circulation and hemorrhage control part. So if the patient is able to talk, if the patient is able to say that what actually happened to the patient, then we assume that the patient's airway is protected. But we have to apply the cervical collar anyhow, because patients might be having some cervical injury as well. Okay, and yes, then we have to see the breathing and the ventilation part. We have to see the vitals of the patient, blood pressure of the patient, saturation of the patient, and is he bleeding from any site or not. Okay, so always and always, this is a part of primary survey. So primary survey includes airway with cervical spine protection, then breathing with the ventilation, then circulation with hemorrhage control. And in this circulation with hemorrhage control, we have to monitor his blood pressure. We have to give IV fluids to the patient. We have to give necessary drugs which are there to stop the bleeding, like tranexamic acid. 1 gram has to be given, stat, in a patient who is severely bleeding. We have to take the necessary samples as well at the same time. And at the same time only, we have to see whether the patient is bleeding from any long bones. Any site of the bleeding should be stopped by applying pressure or by applying a splint, or open fracture should be converted into a like closed fracture, and so that the bleeding stops and patient's pain is also decreased. So all these interventions have to be done in emergency.
Yeah. So I think that sounds like a structured approach also, and I think emergency medicine doctors have all have to be all the time on their toes, and managing different things at same time is also very crucial, I suppose.
Yes.
So now, speaking of interventions in pre-hospital care, like you also spoke about that, let's just touch back on that. So it plays a vital role before a patient even reaches the emergency hall department. So how significant is the pre-hospital blood transfusion and whole blood resuscitation during the golden hour?
Yes, so this is very important question and very important point which you have raised. Actually, pre-hospital care is actually the crux of all the trauma care which we provide in emergency. If a patient has not received a proper pre-hospital care, then patient might lead to there may be some significant permanent complications which the patient might have. Okay, and it can lead to increased morbidity as well as mortality. Yes, so you have quite rightly pointed out regarding this blood transfusion. So blood transfusion is very, very essential if we have a very trained pre-hospital care. Suppose a patient is suffered a road traffic accident and patient is actively bleeding at the site. So uh, the EMTs who are trained in this, they should take a large bore IV cannula, and they can start with the IV fluids on the site itself. IV fluids, and if they have O negative uncross match blood with them, they can transfuse the blood at the same site, so that the blood which has been lost by the patient at the site, that can be recovered to some an extent. Okay. And yes, the patient has to be brought to the emergency ultimately, but the golden hour is this only what we need to do.
Correct.
Okay. If we are able to transfuse the blood at the right time, if we are able to save the patient's life at the right time, that's what is needed from the hospital care, that's what is needed from the EMTs. Okay, so yes, early administration of the blood transfusion is very, very essential, and it has to be a very important part of a pre-hospital care.
Yeah, I think that's an important insight, doctor. And I think I was just curious what happens in the rural parts, like in limited resources. How is it? How can they, with limited resources, how can they actually take care of the golden hour?
See, yes, it is very difficult in the rural areas to like make them aware regarding the golden hour of trauma. But actually, some of the points can be done by the layman persons as well. They can be done by the
Mhm.
people anywhere around the world. Like suppose if a patient has suffered a road traffic accident or anything, patient has, like there's a significant fall from a height of a patient, and he has suffered significant injuries. Normal people can just apply pressure on the bleeding part. They can like cover the bleeding part with the significant, like any bandage or any cloth also, so as to stop the bleeding. Okay. If a patient is like unconscious, patient is not responding, patients should be immediately transported to the nearest hospital which is available nearby any hospital, so that a primary care can be given by a particular doctor, and then the patient can be referred to a particular trauma center in case of significant injuries. But yes, timely recognition of the trauma,
Mhm.
shifting the patient immediately to the nearest hospital has to be done very quickly, has to be recognized. And like suppose the applying any anti bleeding can significantly improve the chances of survival of a patient. So that can be done in a rural setup, and we need to make the people more and more aware regarding this, how they can save the like people's life in the rural area as well.
Yeah, I think awareness and timely action is really important in such cases.
Yes.
Now, Doctor, now moving to the training aspect. So, what are some key protocols that emergency medicine specialists should focus on to optimize golden hour intervention?
Okay. So, yes, regarding training aspects, yes, emergency medicine specialists, they are actually very well trained in the advanced trauma life support. Okay. If I talk about myself, so I am an ATLS instructor as well. I have done my ATLS provider training 3 or 4 times, and I have been an instructor since last 2 or 3 years. So I have been giving this ATLS training to all the students who actually enroll to this course. Okay, and ATLS is very, very, very important, because not only for the students, not only for the like for the postgraduates, for the normal people as well, because they need to recognize why trauma is important, why India has the largest number of
Yes.
trauma patients, and
Mm.
they are not recognized, they do not get the timely interventions which they should have received. And that is why the death which is caused due to trauma is quite high in our country.
Correct.
So that has to be recognized. For that, we need to provide proper training to the emergency physicians, to all the doctors, that if we talk about a primary survey in a trauma, very, very important, that has to be done within few minutes of the arrival of the patient. As I said earlier, that primary survey includes airway with cervical spine protection, breathing with ventilation, and
Mm.
circulation with hemorrhage control. D stands for disability, and E is for exposure and environmental control. So this is very easy, A, B, C, D, E, which has to be followed by all the emergency physician and all the doctors in a trauma care.
Yeah.
So training is very important. Training for the trauma patients, training regarding ATLS, advanced trauma life support, has to be given to all the doctors, especially in our country where trauma is a like major junk, which causes death in a lot of patients. Okay, so that is why training has to be done, and training in the form of ATLS has to be given to all the doctors.
Yeah, I think that's really valuable, doctor, especially for medical professionals are looking to improve trauma outcomes also. So it's really important for
Yes.
them. Now, finally, doctor, let's talk about future. What emerging trends or innovations do you foresee in trauma care that could further improve survival rates during the golden hour?
Yes, so we have been improving, and every now and day we have been improving our trauma like care given to the patients. If I talk about pre-hospital care, starting from the pre-hospital care, so we have enhanced pre-hospital care, which is now the very important topic which we'll find out in the near future. Trauma triage protocols have been made because uh, triage is very important. Triage is actually categorizing the patient as per the criticality of the patient. Okay, so more critical patients have to be shifted. The less critical patients can be shifted after some time. So that we have to recognize. That can be recognized only by the people who actually are giving the pre-hospital care. That is EMS providers. So trauma triage protocols have to be designed. Second important is telemedicine. So yes, this is an era of telemedicine, and India is actually fastly growing in this telemedicine era. There should be a telemedicine setup which has to be made in a particular area where the EMS can directly contact the doctors who are operating this telemedicine center. They can take their advice at the same time what to do regarding that patient, so they can guide them. Telemedicine has actually enabled the paramedics to connect with the trauma surgeons for guidance and improving on-site decision making and readiness upon arrival at the hospital. So yes, telemedicine is very important. Secondly, when the patient arrives in ER, so what improved technologies which we are using is one important is POCUS, that is point of care ultrasound. Yes, the ultrasound is actually has created a boom in the emergency medicine setup, because with this ultrasound we can recognize who is critical, who is like very critical, which patient needs to be shifted to the operation theater immediately. There's a concept which is known as fast focused assessment through sonography in trauma, through which we can recognize whether the patient is having any free fluid, hemoperitoneum is there or not. If the patient is unstable, patient can be shifted directly to operation theaters. So that can be achieved through the point of care ultrasound. Okay. Secondly, which we are working on is AI, that is artificial intelligence. Everyone must have heard about artificial intelligence and predictive analysis. So data driven being developed to analyze the patient data and predict the potential complications, helping to prioritize the treatments and resources. Yes, and thirdly, very important, blood products and resuscitation strategies. Early transfusion of the blood products has shifted, like there is a shift towards administering the whole blood, and early transfusion of the packed red cell blood, plasma, platelets in the emergency setups to manage the hemorrhagic shock more effectively. Okay, and one more thing I want to add to like which actually is the future of trauma is integrated trauma systems. Okay, like
Hmm.
regionalization of trauma care, creating
Correct.
comprehensive trauma networks which ensures that the patients are consistently transported to the nearest trauma center equipped to provide the level of care which is required for the injuries, and the need for standardized guidelines and protocols, which has to be made at the nationalized level, at the state level as well, so that all doctors follow the same guidelines, same standardized guidelines and the protocols for all the trauma patients. Yes, and one more thing which I would like to add is high fidelity simulations. Proper training has to be given to all the doctors regarding trauma. As I said earlier, advanced trauma life support has to be done by all the doctors, has to be like this course is very, very important, has to be done by all the doctors who are practicing in the private as well as government setups so that they can effectively improve um, like the trauma care scenarios in their hospitals. So these are all the futures of like trauma care which we are predicting, and this will definitely improve the trauma care which has been provided.
Yeah, I think the future of emergency medicine really looks promising, doctor. And I think the next 5 years are something which is really interesting to know how where trauma care can go. So thank you for sharing that. And as we wrap up today's session, let me tell you that it has been an enlightening discussion. So thank you so much for sharing those.
Thank you so much. Thank you so much for inviting me. And yes, again and again, I'm telling you that this concept of trauma is not an old concept, which this trauma is very old. In future, also, patient will suffer a lot of traumatic brain injuries. So this trauma concept has to be spread to all the people, all the doctors, and they should know what exactly they need to do in a case of trauma patient. So thank you so much for inviting me, and thank you, Hetvi.
Thank you, Doctor. And actually, you've so rightly said that and highlighted the critical role of also a golden hour in trauma and the evolving strategies to enhance patient care. Thank you so much for sharing those, Doctor. And to our listeners,
Thank
we hope you found this episode informative and insightful. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So, until next time, stay informed and stay safe.